Good afternoon. This is Jay Vanderstoop with Sound Counsel Crisis Communication, and Jennifer and I work to set this up this afternoon. We'll keep this short. Everybody on this call has a lot going on. Now, I thought I should give you 2 minutes on the background of me and my company, so that you, in case you're wondering why is this company and this person speaking right now on this topic. We started the company 11 years ago, and we've done a lot of work for various industries, including the healthcare industry and medical clinics, and UW Medicine has been one of our clients for a long time. And we get referred through a lot of insurance companies and problems around North America. It's happened that I've also done a lot of work on communication with WACA in the last several years, and I want to tell you that I've dealt with hundreds of different trade associations at the federal level and state level, and yours is as good a trade organization, well run and well managed, as any I've ever encountered. And in the last 3 weeks, we have 7 large companies in the nursing home or senior health, senior living industry, and our vice president was 10 years in as the vice president for communication for Royal Caribbean Cruise Line. So we've had 3 cruise line clients in the last 3 weeks, and Michael Sheehan just got back from 10 days down at San Francisco dealing with the ship that was couldn't land there. And we've been dealing with a number of different clients in the nursing home industry in the last few weeks, and I'll say at various stages of dealing with this crisis, from facilities that don't have any residents with symptoms or with positive tests, to others that have positive tests, to others that have some positive tests and residents who have died, to client with multiple deaths coming out of and positive tests coming out of the same facility. So we feel like just in a very short period of time, we've been able to work with people at all ends, all parts of this trail. And I'm not, Sound Counsel does not give legal advice, so I'm not giving you legal advice here. And we're not medical experts. We're not management experts. So, sort of the management of your organization, that's not what you would ever hire us to do. What you would hire us to do is to help you communicate, usually bad news, with your families, with your residents, with the media, and we assume, by the way, anything you communicate with to your staff or residents or families, you just need to assume that's going to be public. Maybe it will, maybe it won't, but the best practice is to assume that it's going to be on the front page of the newspaper. So just some things basic best practices that we kind of preach no matter what the business is, but are particularly important in this crisis time. And I'll just share 3 best practices. And I told Jennifer and Robin ahead of time I can't answer individual questions about individual organizations, because I obviously need to know more than I can get in a quick webinar. But I'll give best practices, and Jennifer has a vehicle through the webinar that if you want to submit questions and that we can answer later, we will. So a couple of lessons and a couple of best practices. The first is transparency. We are advising our clients at this point, given the magnitude of this public health crisis, that you should just assume that any decisions that you make regarding COVID-19, its risk, its potential, and if you have its presence in one of your facilities, is going to be made public. When the dust settles, or maybe before the dust settles even, there will be investigations from a public health perspective. There may well be lawsuits. And the best practice is just to assume that all of your decisions at some point down the road are going to be public. And so how do you want to proceed? Well, you want to proceed in a way that later, when people look back, they will say, well, this organization made the best decisions they could make for the benefit of the residents, for the benefit of the families, and for the surrounding public. Made the best decisions based upon the best information they had at the time. Does that mean you're going to make perfect decisions all the time? Of course not. But the best decisions based on the best information. That's just an approach I will say our company takes generally with all of our clients, but particularly in this crisis. The next basic principle to think about is speed. You need to assume that given the hyper focus on this problem and your industry right now, that your communications to your residents, to your staff, to your families, and maybe ultimately to incoming media needs to be done quickly as you reasonably can. And of course, you have to manage facilities, and you have to manage facilities at a time that is particularly difficult. And given the threat of this virus, you have a lot more protocols to follow, including how do you manage people coming into the facility and suppliers, all those kinds of things. So at a time that's already extremely difficult from a management perspective for those who run nursing homes, I'm telling you yet another burden, and that is that if you have news of this virus present in your facility, you need to move quickly with all reasonable speed. And here's another best practice when you communicate quickly. Just assume, again, anything you say to your residents, anything you say to one group, and I include in one group here, I mean the media and the public, assume that anything you say to one group is going to be known to all groups. And so when you're ready to make a statement, if you need to make a statement as to a situation in your facility, you write one statement. Next advice to you is that your statement needs to be as detailed as possible. And I appreciate and understand that you're not going to violate HIPAA, but the situation, when did the resident come in? How long have they been there? When did they exhibit symptoms? Were they transferred to the hospital? If so, what date? When were they tested? When did you get the notification? What steps did you take as soon as you received the notification? Those kinds of situational facts should be included in what you communicate to everybody. You're going to get these questions, and so prepare your document with as much information as you reasonably and legally can put out. I'll comment on hurdle right here, and again, in our line of work, dealing with crises and helping organizations with bad news, this is always a hurdle. Who in the world wants to issue news to anybody that's bad news? I mean, that just goes against human nature. 99% of the communications expenditure in the world is made by people communicating good news, right? That's what you hire advertising agents to do. They sell your product or your service and put together marketing materials, and your stuff looks great and it's better, faster, stronger, and whatever it is that any organization is trying to promote. 99% of the communication is positive news. It's very hard culturally for organizations to get their minds wrapped around the idea of gee, we're actually going to communicate when we're going to affirmatively communicate when there's bad news. And it's a hard concept, but right now it is the best advice. And I'm not suggesting that every time something happens in your facility, you issue a press release. That's not what I'm suggesting. These things are judgment calls, but I am suggesting that if you have an event in your facility now that relates to COVID-19 and there is a public health element to it, in that case, you need to be prepared to communicate basic facts and communicate them quickly. Last thing, this is a basic principle of effective public communication, and that is maintaining your credibility. You're only credible if you are worthy of being believed. And if you, so anything you put out needs to be the truth. I mean, obviously you may put the information out in the best light of your organization. That's not untruthful, but any information that you put out needs to be the truth. And I know I don't need to tell you that. That's what your mother told you, but it's a very good lesson, especially in these times. And the reason you need to be communicating is because you need to be the person in the organization controlling the narrative about your organization. Otherwise, if you're not, others are going to fill in the blank, and they're going to make up their own narrative about your organization. So those are some best practices that I will say apply all the time, but are particularly acutely important in this crisis, and are things that we have definitely seen on a day-to-day, almost an hour-to-hour work as we've done for clients in your industry over the last 2 or 3 weeks. So I said I'd keep it short. So Jennifer and I decided 20 minutes, but that's 15. And that's the best summary of the best advice I can give you at this time. I'd like to thank WACA, and again, say what a tremendous organization you are blessed to be represented by and work with. And I wish you all the very best at this difficult time. Thank you.
Thank you, Jay. We appreciate you speaking for us today. And thank you, everyone, for joining us. We will post this to our webpage, the recording. Take care, everybody. Thank you.